Hello, my name is Erica Parker. Today I'm going to be performing an abdominal assessment. If this were my patient and not a mannequin, I would start off by asking questions about their diet, what their diet consists of, if there's any restrictions to their diet, like a low fiber diet or a high fiber diet, what their bowel movements consist of, how frequently, if there needs to be any stool softeners or laxatives and how often that they take them. And then also if there's any pain or bleeding during those bowel movements. Okay, so next, and again, if this were my patient and not a mannequin, I would be lifting the shirt to expose that abdominal area. But of course, I want to inspect and make sure that looking at the umbilicus, making sure that everything is midline, that I don't have any obvious bulges that could be a hernia, making sure there's no scars or lesions, checking out the color and consistency of the skin, making sure, no jaundice, nothing that I can obviously see. And now that everything looks a symmetry, next I would like to listen to the bowel sounds. And what we'll do is we want to listen in all four quadrants. We want to at least listen for 15 seconds. Although if you do hear bowel sounds, you can go ahead and move on to the next quadrant. We want to start with the right lower quadrant and then work our way clockwise, going then to the right upper quadrant, then to the left upper quadrant, and then the left lower quadrant. Okay. Okay, and just taking note that there is normal bowel sounds, either noting that they're just active or hyperactive or even hypoactive. So I'm going to be assessing for palpating for the liver. So I want to start at the mid-clavicular line, and it's going to be off to the right side. So I'm just going to percuss, and at first I'll be hearing the lung sounds. And then as soon as I start to hear a dull sound, that will be the liver. And that's usually fifth intercostal space, mid-clavicular line. And then I'll just kind of make a note or, a marker to draw that line there. And then I'm going to start from the abdomen and work my way up to find the bottom of the liver. So I'm just going to percuss. I should be hearing tympani. And as soon as I hear the dull sound, that's where I will mark the end of my liver. And that usually is about 6 to 12 centimeters. 6 centimeters is more or less for the women are on the smaller side. And then just kind of palpate around that area, making sure that there's no pain or tenderness. Okay. And then now we want to palpate for the spleen. So that's going to be on my left side. Here I'm going to percuss. I'm going to start from the abdomen and work my way up. And I should be hearing tympani. And then as soon as I hear a dull sound, that will be my spleen. That's usually the 9th and 10th intercostal space. And we just kind of take note of that, palpate around the actual spleen, noting if there's any pain or tenderness there. If there were, then we would do more of an investigation there and kind of even taking from the back side and palpating. Okay, so next we're going to palpate the bladder, making sure that there's no pain or tenderness or any distension. Asking my patient what their urine habits are, frequency, the color of the urine, if there's any unusual smell to it. Okay, so here I'm just going to start palpating the bladder making sure that they're right above the pubis, making sure there's no distension or pain or discomfort. Okay, and you're right there. Okay, and then next I'm going to be assessing for any signs of appendicitis and or assessing the gallbladder. I'm going to be assessing for any appendicitis or checking out the gallbladder, making sure it's not inflamed or enlarged. So first I'm just going to, over on the left side, I'm just going to push down and we're going to ask any pain or tenderness. No? Okay, so that should be good. So they're clear for that sign. And then we are the Murphy test. So that's where I'm going to palpate for the liver. I'm going to ask them to take a deep breath in, and I'm going to palpate, and then any pain or tenderness, and then this should be, and there's not, so this should be good for the gallbladder. So that test would be also negative. And we are done with the assessment of the abdomen.